All right, let's dive in. If you're an IT pro in life sciences, you've probably heard 21 CFR Part 11 thrown around. And maybe you even felt a little bit of dread. It sounds super complicated, right? Well, the good news is it's really about one thing you're already an expert in: data integrity. So we're going to demystify this thing and break down exactly what it means for you and your daily work.
So this really gets to the core of it, right? In a world that's all digital, how can you prove that a record hasn't been messed with? Think about it. Back in the day, you had a signed piece of paper in a locked filing cabinet. It was pretty secure. The FDA needed a way to make electronic records just as trustworthy. And that's what Part 11 is. It's basically the rule book for building that trust in the digital world.
And listen, the stakes here are incredibly high. Get this, a whopping 80%, that's 8 out of 10, of recent FDA warning letters point to failures in data integrity. We're talking product recalls, huge delays in getting drugs approved, and massive, massive fines. So this isn't just some dusty old rule they forget about. No way. They are actively enforcing this, and getting it wrong has serious real-world consequences for the business. It is so much more than just a compliance checkbox.
So what's the big deal here? Well, the entire regulation is built on this one core idea: data integrity. The FDA themselves break it down into 3 simple words: completeness, consistency, and accuracy. Just ask yourself, is all the data actually there? Does it all make sense together? And most importantly, does it reflect what really happened? If you can nail those 3 things, you're on the right track. Okay, to make this even easier, regulators came up with this handy little acronym, ALCOA. Think of it as your go-to checklist for making sure your data is solid. So A is for attributable. Can we tell who did something and when? L is for legible. Can you actually read and understand it, even years from now? C is for contemporaneous. Was it recorded right when it happened, not a week later? O is for original. Is this the first recording or a certified true copy? And finally, A again for accurate. Does it match reality? If you can tick yes for all 5 of those, you're in great shape.
All right, so instead of getting lost in a giant list of rules, let's just break Part 11 down into 3 main pillars. These are the big areas where you, the IT team, play an absolutely massive role. We've got system controls and validation, secure audit trails, and trustworthy e-signatures. Let's take a look at each one. So, pillar number 1 is all about the systems themselves. It kicks off with something called Computer System Validation, or CSV. Now, for us in IT, that means you can't just, install some software and call it a day. You have to formally prove with documented testing that it works exactly as intended every single time. And a huge piece of this puzzle is access control. We're talking strict, role-based permissions. And seriously, no more shared accounts. You've got to be able to show exactly who can touch what data and when.
Next up, pillar 2. The audit trail. I love how the FDA puts it. They call it the who, what, when, and why of a record. It's perfect. Just think of it as a super secure automatic logbook. Every time someone creates, changes, or even deletes a piece of data, it gets recorded. And here's the kicker. That trail has to be totally secure. It can't be changed or erased by anyone. It's literally the ultimate unchangeable proof of what happened to that data. And that brings us to our 3rd pillar, electronic signatures. Now, it's really important to get this right. There is a huge difference between a normal login and a compliant e-signature. A regular login, that's just like using a key to open the front door. It just gets you into the system. But a Part 11 e-signature, that's like signing a legal document inside a bank vault. It's a big deal. It requires at least 2 separate things, like your user ID plus a unique password, to create a legally binding signature that says, yes, I, the specific person, am approving the specific action. Okay, so what does this all mean for you on the IT team? Think of this as your playbook. When we talk about validation, that's you developing and running the test scripts to prove the system works. Access control? You're the ones implementing unique user IDs and role-based permissions, and yes, that means getting rid of those shared accounts for good. For audit trails, it's your job to make sure those features are switched on and that the logs are totally secure. Your work on backups, on archives, on e-signatures, you are literally building the technical foundation for the entire company's compliance. Now, one more key thing to think about is where your systems actually live. Part 11 makes a really important distinction between a closed system and an open one. A closed system is basically anything you control completely, like a server sitting in your own data center. But an open system, that's where you don't have full control of the environment. Think cloud services, SaaS platforms. For those open systems, you need all the controls we just talked about, plus extra security. And the big one is encryption. That means if you're using the cloud for regulated data, encryption isn't just a nice-to-have anymore. It becomes an absolute, non-negotiable requirement.
At the end of the day, this really gets to the bigger picture. While you guys in IT are the ones building and maintaining the technical backbone, data integrity isn't just an IT problem. It's a responsibility that's shared across the whole company. Anyone who touches what we call GXP data, so data from labs, manufacturing, clinical trials, they all own a piece of this. The work you do enables everyone to do their jobs correctly and safely. The systems you build and secure are what protect the data that ultimately protects patient safety. It's that important.
So, to wrap this all up, Part 11 isn't just about ticking boxes and following rules. It's about a mindset. It's about architecting and building systems that are fundamentally trustworthy. And as we look to the future, the challenges are only going to get more interesting. With AI and machine learning starting to create and modify records, how are we going to validate that? How do we make an AI's actions as traceable and attributable as a human's? That's the next big frontier, and it's a place where IT professionals like you are going to be absolutely critical.